Hi friends, this episode of the Cozy Lung Lounge is brought to you by Hoot Nanny Joy, where your health and wellness take center stage. At Hoot Nanny Joy, we know how overwhelming it can be to stay on top of your health, especially when life gets busy or chronic illness adds challenges. That's why we've created self-study programs designed to meet you right where you are. These programs are simple, flexible, and packed with tools to help you thrive. And they come with something extra, access to a live health coach. That's me, to guide you every step of the way. Whether it's improving your sleep, learning to nourish your body, or managing stress, our programs combine proven science with practical, real-life strategies. You can work at your own pace, get the answers you need during coaching sessions, and feel confident you're making progress. Ready to take that first step? Visit hootnannyjoy.com to explore the programs and choose the one that fits your journey best. Hoot Nanny Joy, because your health deserves a little joy. Hey everybody, welcome to the Cozy Lung Lounge. I'm Gina and I'm here with my friends. Tonight we're talking about the eosinophilic asthma. That's a really special kind of asthma. I'm here with Kelly and Amy.
Hi, everybody. If you can see me around my cat.
Hey, everybody. It's Amy. I'm really excited about this topic. This was actually a listener request that we got from one of our Facebook posts. So I'm really excited to cover this topic.
I love that we have listeners that are suggesting things. That's wonderful.
Well, it's hard to define, should I say, differentiate eosinophilic asthma from regular asthma. It's often called the hidden asthma because it doesn't, the onset doesn't happen often until adulthood. So a lot of times if kids have asthma, they tend to outgrow their asthma by the time they're 8 years old. They continue to grow lung tissue till they're 8 years old, and sometimes they can outgrow asthma. It is possible, but sometimes as adults, we end up with eosinophilic asthma, which is where we have too many white blood cells, and they released a host of inflammatory factors that just wreak havoc with the lungs. And the latest research on it, a lot of times to differentiate this asthma takes a couple of tests, depending on your pulmonologist, but Gina, I can't remember. A lot of these patients they go through inhalers and they say inhalers help a little, but the regular asthmatic who's on a routine of controllers, right, relievers, et cetera, it's different for these people with eosinophilic asthma. So one of the things you might want to take note of if you have been labeled an asthmatic and you're on a bunch of inhalers and you've tried 100 different ones and nothing's doing anything, that probably means you need to move up to a biologic, which may mean you have eosinophilic asthma. That's a very simplified explanation. Don't take that as a diagnosis or anything, but that's my understanding of people with eosinophilic asthma.
It definitely seems like this eosinophilic asthma is more of an intrinsic thing. So when I was doing some research, because this isn't something that I have learned a whole lot about, I think generally when you go to school, especially for me as an exercise physiologist, they just kind of lump asthma all into one big group. But eosinophilic asthma is really interesting because it's due to this overdevelopment of and excess of these white blood cells, and it causes chronic airway inflammation, and that can eventually over time cause damage to your lungs. So it was really interesting hearing more about this compared to the extrinsic asthma that we normally hear about, where it may not be your typical allergens in your environment that cause some of the exacerbations that you might experience if you do have eosinophilic asthma.
Now, if we want to talk about some of the science behind it, I'm going to read some of our notes here. But this happens down in the cells, way down through all of the structures of your lungs down to the cells. There's your immune system is working all of the time. And in an eosinophilic asthma, the immune system gets stuck in a type 2 high inflammatory state. And you have something called cytokines. And cytokines, specifically IL-5, is the food for eosinophils. There's also some 4s and 13s. And every one of those cytokines has a special role. Now, I won't go into the roles of all of them, But when you're choosing a biologic, those sort of things are very important. You have airway damage at that airway level because eosinophils are releasing major basic protein, an MBP, which acts like acid on the airway lining. And then all of those things that are happening cause your airways to remodel. That chronic inflammation leads to thickening of that basement membrane and permanent scarring so that it can't bounce back like asthma used to bounce back open and close. It gets more into the asthma COPD overlap syndrome if we have that chronic inflammation for years.
And from what it sounds like, from some of my research, these asthma attacks tend to happen more frequently, and they can oftentimes be more severe. And a little bit like what Kelly was saying, they can become resistant to the inhaled corticosteroids. So if you really don't feel like your inhalers are working the way that they're supposed to, if you just have a very broad diagnosis of asthma, it may be important to go ahead and talk with your doctor and see if there's any testing that you may be able to get done in order to determine if it's the what they sometimes call e-asthma or eosinophilic asthma.
And another hallmark sign is that there's no particular triggers. In other words, with a regular asthmatic, sometimes we can pinpoint what the triggers are. It could be pollens, it could be, a myriad of things. Everybody's triggers are different. But with eosinophilic asthma, there's no particular external trigger happening. It just happens when it happens. And these people often go on steroids multiple times a year, which fixes the problem, but it's a short-term fix. We really need to get further testing done, figure out which biologic will help you stop that cytokine cascade of all those inflammatory things. And eosinophils it's normal to have eosinophils in your blood. We have those in our body. It's just when there's too many, when there's too many of them, right, and they're overrun and they're releasing all the bad stuff, that causes problems. Speaking of problems,
He's just enjoying the podcast today. For anybody who's listening to the audio, Kelly's cat has decided to join on in today, and he is loving her desk right now.
And he's very fluffy, and I'm allergic to cats, so he's making me sneeze even through the airways with all that fluffy fur.
Yeah, he's the perfect thing of what not to do if you have asthma. He joins every podcast. He always wants to know who's on. But yes, for our radio listeners, podcast listeners, usually he lays low. But today, I don't know. He's all excited about this.
It's because he's excited that a listener gave us a topic.
That could be. Okay. Well, thank you, listener, whoever you are.
So we do have some common comorbidities that are associated with e-asthma. So one of them is nasal polyps, and the other one is aspirin sensitivity. So those three kind of go hand in hand. A lot of times you may see those together as kind of a triad with somebody who may have e-asthma. Living with a chronic respiratory condition doesn't mean giving up the things you love to do. At Blue Zone Health, we're here to help you breathe easier and rebuild your strength. Our online cardiopulmonary rehab program offers tailored exercises, self-management training, and expert support from certified respiratory therapists. Accessible anytime, it's designed to reduce breathlessness, improve lung function, and empower you, all while connecting you with a supportive community. Visit bluezone.health and take the first step towards stronger lungs and a healthier future. Blue Zone Health. Breathe better, live better.
Now, some of the symptoms of e-asthma or eosinophilic asthma, the wheezes are a little bit different than those in regular asthma. They feel a little bit different. Now, I don't have this kind, so these are things that are reported by patients, but the symptoms often are more persistent and severe than mild asthma. Your chest gets very heavy. The inflammation is very deep in your chest, and it feels like chest tightness and heaviness, not more so than a high-pitched wheeze. We hear those the wheezes much deeper in the chest. Thick plugs of mucus are very difficult to clear in this kind of asthma. We've got the airways working overtime to clear the debris, and so they're secreting that thick mucus. And then all of those factors are causing a lot of exacerbations. And if you remember, an exacerbation is a flare-up. And in this case, you might need oral steroids or prednisone more of the times a year than not. And if you're having those frequent exacerbations, that is one of those things that helps your insurance qualify you for the new biologic therapy.
Many of the symptoms are the same, except a lot of the patients report feeling like their chest just feels heavy, and they have a lot of mucus production. And again, they're on and off of steroids, just trying to keep things at bay, keep things quiet.
How do you know if you have eosinophilic asthma or regular asthma?
So there's lots of different tests you can do. So the first one is a blood test. So they can actually draw blood and check your eosinophil count to see how high your numbers are. So that's one way that they can test just with a simple blood draw. But I'm sure there's some other tests that kind of go hand in hand with that.
They used to years ago do a nasal eos. They did a nasal swab and just measured your nasal eosinophils. But yeah, now there's a blood test. The pheno test, which is your fraction of exhaled nitric oxide, that's actually something they use to make sure that the biologic is working. So they may use that initially to see if you have a high number, meaning just a high amount of inflammatory properties in your exhaled breath. But you'll keep coming back once you're on biologics to get pheno tested just to see if it's working. And the pheno testing it's not a pulmonary function test. You don't have to blow your brains out when you're in there. It's just a simple one-time exhale done. So don't be afraid of it.
We can even get more invasive in the diagnosis and testing. If you have a bronchoscopy, they can go in and look at that sputum that's in there and actually collect some of that. If they don't go in there, you can also cough some of that up. But if you have eosinophils along your airway tract, then you'll be able to diagnose eosinophilic asthma that way. That's the same as if you've had a colonoscopy and have eosinophilic gut disease. A lot of people have eosinophilic esophagitis, and that would be eosinophils in the esophagus. And so finding those eosinophils in the airway would be the gold standard way of diagnosing eosinophilic asthma. Then, of course, my favorite, spirometry. Always going to check to see if there's any obstruction to airflow, and does the albuterol make it better? And so that's always a basic test that we're going to use for every lung disease.
So with some of the treatments, I know we talked a little bit about the inhaled corticosteroids. I think even if it is eosinophilic asthma, you probably will still have an inhaled corticosteroid because it does help, but it kind of has this ceiling of effectiveness where at some point it may not be as effective as we hope, but you will probably still have a rescue inhaler or an inhaled corticosteroid on hand just in case you need it.
Definitely, if you feel like all your inhalers aren't working, and of course the steroids does it for you as a short fix, but not a long one, definitely see your doctor, get the spirometry test done, and your doctor should order a pheno test for you as well as a blood test to see. Because the most important thing, no matter what kind of asthma you have or anything else, is your medication regimen doing it for you? Because if it's not, we need to step up, and there's a lot of things we can do to step up trying to keep those symptoms at bay. So always be sure to ask. You're not stuck with your inhaler that does nothing.
And I'll tell you, I do spirometry testing regularly on patients that are using biologics, and they are generally very overwhelmingly positive towards their biologics. They know when their next dose is. Sometimes it's like a 60-day dosing. Boy, if they're on day 52, they're starting to feel it, for example. And so they know when those dosing schedule is, and they feel so much better. Many times they don't even need any inhalers anymore. And if you're an inhaler-dependent asthmatic, that's just kind of a very strange way of living. But biologics can be very, very helpful for many people.
And then oftentimes, if you're kind of transitioning into a biologic and having a lot of concerns with your breathing, they may also give you steroids, like an oral steroid, kind of to help you carry over and have better breathing until those biologics kick in all the way.
The biologics are interesting. It's kind of the future of precision medicine, as we call it, because it's targeted toward you. There's several different brands and several different types, but what the blood test does is help us figure out which one will be the best for you.
And you notice we're not saying any one name of biologics. There's many brand names. There's also many of the generic names that I can't pronounce. So a broad category of biologics is appropriate for our conversation tonight. If you want to know more, your doctor certainly can help steer you towards the right one.
Absolutely.
And I know, Gina, you mentioned this a little bit earlier, but they do also have a treatment that basically helps starve and kill the eosinophils to kind of help prevent some of that inflammation from going on. So there is medication for that as well.
Well, this deep dive into here at the end of the episode, I'm still tripping over my words. The episode in eosinophilic asthma has been really interesting. I learned a lot from each of you about this topic. And I know with the science of biologic therapies, we'll hear a lot more about this in the future.
Absolutely. Thank you guys so much for joining us. I think this is a good introduction to a different type of asthma that we don't normally hear about and that is very hard to pronounce, but you guys can always call it e-asthma for short to help it be a little bit easier.
We'll see everybody on the next episode.
Bye,
Thanks,
everyone.
guys.
Hi, I'm Kelly, a registered respiratory therapist with Blue Zone Health. Do you feel breathless much of the time? Are you unsure of how to manage your breathlessness? Is it keeping you from doing all the things that you would like to do? I'm here to help you learn to work with your healthcare team to come up with a plan that will work for you. There are lots of tools, tips, and tricks and breathing exercises that you can do now that will help you breathe easier and more effectively. I look forward to joining you on this journey and empowering you to breathe better.